And now, again, when it comes to dealing with situations like this, the more idea exchanging and the more experience exchanging that goes on, the much better it is for everyone involved.
Yeah, absolutely. As you said earlier on, this is still a very, very new field. There's no set diagnosis and no set treatment plans. I mean, there's a few that have been research based, but there's a lot of stuff out there that we can do as providers and as people helping these kids to really, really improve the outcomes. I mean, how do you take a kid that's got a learning disability or a learning challenge and put them into a mainstream classroom? There's a number of things that we can do, and each child learns very differently. So it's how to provide those providers with that, the tool sets to make really, really good decisions.
Do you find that when it comes to the parents of a child who may have a learning disability, that there's kind of that do I tell the teacher that the child has a learning disability and hope that the teacher will utilize that to modify the way they interact with the child, or do I tell the teacher and then the child is branded as a problem child? Do you find that there's a lot of that going on in this new era that we're in?
That's most probably a question for Charlotte, but I know that one of the things that you have to be aware of or cognizant of the fact is that everyone's going to react differently to these problem kids, and it's finding ways to actually teach people that these are not necessarily problem kids. They just learn a little bit differently. But some of these kids are incredibly instructional to the other children in the classroom. Some of them are incredibly compassionate, have got incredible skill set in certain areas, and when they're engaged in the rest of the classroom, the amount of learning that the other kids as well as the teacher receives is just incredible. So it's not necessarily that they're good or bad, just different.
Well, I didn't mean to.
No, I meant
I was just saying that a lot of times when you say to a teacher, well, Johnny has a learning disability, then the teacher's automatically going to say, okay, well, this child is going to be a problem. Exactly. Charlotte, you could expand on that for us.
Sure. One thing that we've seen really successful so far in Butterfly Effects, who utilizes Central Reach's software, is being able to finally provide teachers with a path or a guide about how to go about, meeting this child's needs in their classroom setting. Most teachers got in the field, they want to help, they want to feel empowered, but oftentimes when faced with these challenges, they simply don't know what to do, especially when they've got 30 other children that they're trying to meet the needs of. Exactly. And so what's been really powerful about this system is teachers are able to log on. We as therapists upload our goals. So let's say Johnny's having some behavioral problems in the classroom. As his behavior analyst, I put together a plan. The parents who have full access to the account give the teachers would set the teachers up so they could log in, see Johnny's goals, see what we're working on in the home, bring that into the classroom. So hopefully the idea behind is that we're all starting to work as a collaborative team. So the teacher can now give me feedback, who's working in the home, about how he's doing with his behavior. And I think just the power behind that, giving everyone access to the same information is what makes for effective outcomes.
And I would think too that being able to share information with the teacher, I mean, that's kind of ground zero. That's where, with the exception of the summertime, that's where children spend a large majority of their day, and that's where they spend a large majority of their time being observed. And so the teachers, if they're in the right frame of mind, can be an amazing, valuable resource in the work that you do.
Yeah, input is so important. If we take, for example, just thinking of, let's say, a child with autism, in addition to the teacher, they also probably have a treating neurologist. They are going to see their pediatrician. They might, have some medical issues going on. In some cases, they not only have a pediatrician, they have a developmental pediatrician. They'll have a treating OT at school, and now they'll have a treating OT at home, a speech at school, a speech at home. Now a speech who only does oral motor, that doesn't do articulation, a behavior analyst, maybe a few tutors that are working with them in the afternoon. Most of our clients, when we actually look at the number of providers that they have collaborating, on one child's account, average anywhere between 10 and 15 people.
Wow.
And so trying to organize that information is an incredibly overwhelming task if you think about it. In the olden days, what we used to do is, I say olden, but 6 months ago now, as this software seems to be, coming out by the day, but right. You'd pick up the phone, you try and reach the teacher or the speech who you're trying to work with. Mm-hmm. Well, of course, they're busy. They get back to you, but they get back to you 3 weeks later. And now all of a sudden, the whole thing you called them about is no longer even relevant because you're faced with new concerns and new challenges. And so what's the beautiful thing, what technology's enabled us to do is that at any point, at any time during the day, I can log into Johnny's account and see how he's doing. I can share that information immediately and get that information to who needs it to make those decisions for the child. So it's very powerful.
Ron, one of the things that Unicorn found very interesting about this is, again, you have a small army essentially working on helping your child progress. So it really helped parents keep track of the information, organize it, and and hold their providers accountable, because we really want to make sure that, most of these treatments are out-of-pocket expenses. The insurance companies aren't covering it. So parents really need to be educated consumers. So this allows parents to be able to really track visually what's going on across all of these interventions to see what's really working. The other interesting thing, I talked about the gap from getting what's being done in the laboratory into the field. What Michael's been able to do with Central Reach is really consolidate a huge body of data that could then be taken from the field back into a laboratory and then tested to see, really isolate what is it that's working for which kids. And that to Unicorn was really an attractive feature.
Well, I'm glad you brought that up, Michael. And I would think, just knowing the little bit that I do about learning disabilities, is that every child is different. Every child's makeup, every child's the way they react to the disability is different. Every child suffers different levels of learning disability. So I think, as you mentioned, Charlotte, trying to compile all this information can sometimes be an overwhelming task, and I guess that's where you come in.
Yeah, I mean, the difficult part is also now is getting relevance from the data, because as you'll find is that with these kids that they're impacted by so many different factors, and so it's determining and then understanding and then working on what those factors are and how to make those factors work in the kids' best interest. So getting the data is step number one, and we don't have all the answers by no means, but just getting the data is the first step, and then allowing everyone to look at the data and let the smart people take over. That's what I always say. We'll just put it in a bucket. Eventually the smart people will take over.
Well, I know the program is brand new, and I know you've just been working on the collecting, but have you found some things that surprised you? Some thoughts that you may have had that you've totally changed your approach to dealing with children in just the early data that you've compiled so far?
I think just the pure vast amount of information is what's been what has struck me, and just the challenge of organizing that. And so I think, if anything, that's been the most eye-opening experience for me is how do we, as providers, truly go in and provide the most effective services if we have all this information that up until this point haven't really been able to effectively organize. And so I think we're going to be able to get some really profound information from this, because just things like being able to put in every child's their diagnostic scores, their IQ scores, their developmental batteries that they had, and then being able to repeat those and look and see what those outcomes were, being able to look and see what providers they reached in the community, how much they were accessing those providers. I just think that the power of that information is going to dramatically impact service delivery and really help shape it and hopefully support it too, if we can see those positive outcomes coming, knowing where we want the funding to go towards the programs that are in fact working. So I think it'll be pretty powerful stuff.
Something that Michael touched on, and Sharon and I have spoken about this here on the show, on the Unicorn Children's Foundation show, Dare to Dream. A lot of parents, when confronted, not confronted is not probably the proper term, but informed by a professional that your child may suffer from a learning disability, a lot of times the first reaction from the parent is, but my child is so smart. Mm-hmm. But I think, as Sharon and I have talked about on the program, it seems like a lot of children who do have learning disabilities have incredible IQs. It's kind of a strange yin and yang, if you will, which is also the wrong term. But do you